Have you ever felt a sudden wave of dizziness that stopped you in your tracks, even for just a moment? A patient once told me her dizziness felt harmless, something she believed was simply part of getting older, so she ignored it for years. I want you to imagine this. What if that brief moment of dizziness was your brain signaling a problem long before a stroke ever happened? Most seniors underestimate dizziness. They blame it on feeling tired, having low energy, getting up too quickly, or just aging in general. And I understand why. Dizziness feels so small, so quick, so easy to dismiss. But what many people don't realize is that sudden dizziness can be one of the earliest signals that the brain isn't receiving enough oxygen. When blood flow changes even slightly, the brain reacts immediately. A sudden drop in circulation, a brief spike in blood pressure, or a change in heart rhythm can all trigger that sensation. And for adults over 60, these moments can be early indicators of increased stroke risk. In my years of caring for older adults, I've seen so many seniors assume dizziness is nothing more than a nuisance. But often, it's not a simple inconvenience. It's the body whispering for attention. It's the brain asking for help. Dismissing it as normal aging can mean missing the chance to recognize a warning sign before it becomes something much more serious. This video reveals the truth no one told about sudden dizziness and its hidden link to stroke. My goal is not to frighten you, but to empower you. When you understand what your body is trying to say, you gain the ability to protect yourself in ways that truly matter. Your body has protected you for decades. Now it's time to listen when it whispers. Stay with me. This information could change the way you understand your health. And if this message already resonates with you, I invite you to subscribe and continue learning with Senior Health Daily. In the next part, we'll explore the deeper science behind dizziness and why it becomes more dangerous as we age. The science made simple, sudden dizziness may feel like a harmless moment, something that passes quickly enough for you to forget about it. But inside the body, especially inside the brain, dizziness is often a sign that something has shifted in the flow of blood and oxygen. I want you to imagine your brain as a beautifully intricate machine, powered by a steady stream of fuel. That fuel is oxygen carried through your bloodstream. When that supply even slightly flickers, the brain reacts immediately. Dizziness is often the first alarm bell. Blood flow is like electricity to the brain. Even a small disruption can make the lights flicker. When the brain senses that it's not getting the oxygen it needs, dizziness can appear suddenly without warning, as a way of saying something isn't right. These disruptions often come from changes in circulation. As we age, circulation becomes more delicate and less stable, especially after 60. Arteries stiffen naturally with age, and that stiffness makes it harder for blood to travel smoothly. The heart has to push more forcefully, and when pressure fluctuates even slightly, the brain feels the effect first. One reason dizziness becomes more common with age is that the body doesn't regulate blood pressure as quickly as it used to. When you're younger, your blood pressure adjusts instantly when you stand up, sit down, or turn your head. But after 60, that adjustment slows down. It may take a moment or two for the body to correct itself. During that moment, if blood pressure drops or rises suddenly, the brain receives less oxygen and dizziness appears. Heart rhythm changes also play a role. Many older adults experience occasional irregular heartbeats, even if they aren't aware of it. When the heartbeat becomes uneven, the blood flow to the brain can fluctuate. The brain is extremely sensitive to these changes. Even a momentary lapse can cause dizziness that feels like it comes out of nowhere. Another factor is dehydration. Many seniors don't drink enough water throughout the day, either because they forget or because their sense of thirst has weakened over time. When the body is dehydrated, blood becomes slightly thicker. Think about a river that loses water. The flow becomes slower, heavier, and harder to move. Thickened blood requires more pressure for the heart to pump it upward toward the brain. This combination of thicker blood and reduced circulation makes dizziness more likely. And when dizziness appears in this context, it can be a sign that the brain is under stress and more vulnerable than usual. Medications can also influence this process. Drugs for blood pressure, heart conditions, pain, or even sleep can alter how the body manages circulation. Many medications cause dehydration or temporarily lower blood pressure. These changes might be subtle, but the brain senses them instantly, and dizziness follows. Seniors often have complex medication routines, and even slight imbalances can affect how consistently blood reaches the brain. This link between sudden dizziness and stroke risk becomes clearer when you consider one simple truth. The brain depends on a continuous, stable supply of oxygen. When that flow becomes unstable, when the brain has to work harder to get what it needs, the risk of stroke increases. Dizziness isn't always dangerous, of course, but when it appears suddenly, especially in adults over 60, it's a signal worth listening to. Now that we've uncovered how dizziness begins inside the brain, we can explore the hidden stroke risks many seniors never hear about. In the next part, we'll talk about the warning signs that often disguise themselves as harmless symptoms, even when they're anything but harmless. Hidden stroke risks. Doctors don't have time to explain. Sudden dizziness rarely comes alone. It often brings companions so subtle that most seniors brush them off without a second thought. These small moments pass quickly, and because they disappear as fast as they arrive, many people assume they mean nothing. But inside the brain, these moments can reflect deeper issues, often the early stages of circulation problems that set the stage for a stroke. One of the most commonly overlooked dangers is the silent stroke. A silent stroke often doesn't look or feel like a dramatic medical event. It doesn't always cause slurred speech, collapsing, or paralysis. Instead, it shows up in tiny ways. A sudden moment of brain fog that you blame on poor sleep. A few seconds of imbalance that you shrug off. Slower thinking that you attribute to age. Or brief confusion that seems too minor to mention. These symptoms often appear in the days or weeks before a larger stroke, but because they don't feel frightening, they rarely get the attention they deserve. Dizziness becomes even more concerning when it arrives with other subtle clues. Many older adults report a feeling of pressure behind the eyes, as if their vision needs a moment to catch up. Others feel a brief numbness in a hand or cheek, something that fades almost immediately. Some experience a heaviness in the neck that they blame on sleeping wrong, or a flicker in their vision that lasts only seconds. There are moments when the body feels off balance, but because the feeling disappears, it's easy to dismiss. These may seem unrelated, but many of them come from the same place: unstable blood flow to the brain. Dizziness mixed with high blood pressure is one of the most dangerous combinations. When the heart pumps too forcefully against stiff arteries, blood flow becomes uneven. Pressure can surge in an instant. If dizziness appears during these spikes, it means the brain is receiving blood in a way that is inconsistent, forceful, and strained. That fluctuation is a warning sign many seniors don't recognize. Something as simple as a salty meal can trigger this pattern. A large restaurant dish filled with hidden sodium can raise blood pressure dramatically within hours. When the body tries to compensate, circulation becomes unstable. Many seniors feel a wave of dizziness after eating out, but they don't connect the dots. They chalk it up to standing too fast or being tired. In reality, the body is struggling to manage a sudden rise in pressure. Dehydration makes this even worse. When there isn't enough water in the body, blood thickens and slows. The heart must work harder to push it upward to the brain. This creates a perfect storm: thickened blood, higher pressure, unstable flow, and less oxygen reaching critical areas. The brain reacts instantly, often with dizziness, even if it lasts only a moment. Irregular heart rhythms also contribute to this problem. When the heartbeat stutters or speeds up unexpectedly, the brain receives blood unevenly. That irregularity, even if brief, can trigger dizziness that feels random or unexplained. But inside the body, the brain is reacting to a sudden change in its oxygen supply. Then there are the hidden sodium sources that worsen these issues. Many seniors don't realize how much sodium is in foods they consider harmless. Canned soups, sauces, bread, frozen dinners, and most restaurant meals all contain far more sodium than the body needs. Sodium pulls water out of the cells, raising blood pressure and thickening the blood. When dizziness follows a salty meal, it's often the body flashing a red light. These small, easily overlooked patterns create a dangerous environment inside the brain. They can indicate circulation problems that are unpredictable and unstable. They can reveal that the brain is not receiving the steady, even flow it needs to function clearly and safely, and they often appear days, weeks, or even months before a major stroke. Understanding these hidden risks is the first step toward protecting yourself. In the next part, I want to share real stories from my own experience. Stories of people who ignored these tiny whispers until the body could no longer stay quiet, and stories of those who listened early enough to change the outcome. Real cases from practice. Over the years, I've learned that the body rarely stays silent when something is wrong. It always tries to speak. It whispers first, gently and quietly, long before it ever screams. And sudden dizziness is one of those whispers. To help you understand just how important these signals can be, I want to share a few real cases from my practice. The identities are changed, but the lessons are very real. One of my patients, a woman in her early 70s, came to see me because she kept experiencing what she called normal neck pain. She insisted it was nothing, something she had lived with for months, but during our conversation, she casually mentioned that she also felt a brief dizziness whenever she turned her head too quickly. It lasted only a second, so she never thought much of it. Still, something about the combination concerned me. We ran a few tests and discovered that she was dealing with both chronic dehydration and fluctuating blood pressure. Her sodium intake was much higher than she realized because of the canned soups she relied on for convenience. The dizziness wasn't from her neck at all. It was her brain responding to unstable blood flow. By addressing her hydration, adjusting her diet, and stabilizing her blood pressure, we prevented what could have become a life-changing stroke. Another patient, a man in his mid-60s, believed his blood pressure was perfectly fine because it looked normal during home readings. But one evening, after a salty restaurant meal and a long day without drinking water, he suddenly felt dizzy while walking to his car. The sensation passed quickly, so he dismissed it. The next morning, he woke up confused and unsteady. A hospital scan revealed he had suffered a mini-stroke. The trigger wasn't random. The combination of dehydration, high sodium, and a temporary surge in blood pressure created the perfect conditions for that stroke. When we went back through his habits, the dizziness he felt the night before made perfect sense. It was the warning his brain tried to give him. Then there was a woman in her late 60s whose family became concerned because she had started forgetting conversations and losing her balance more often. They thought it was early dementia. When she came to me, she described several moments of dizziness over the past year. They were short and mild, barely noticeable, but they were consistent. After further testing, we discovered she had experienced multiple silent strokes over the years. The dizziness had been the earliest clue, long before the more visible symptoms appeared. Her brain had been struggling with unstable blood flow for a long time, and those tiny warning signs were overlooked until the damage became harder to reverse. What these stories have in common is simple. None of these individuals experienced dramatic symptoms at first. They didn't collapse. They didn't lose consciousness. They felt fleeting dizziness, pressure, imbalance, or confusion. Little moments that disappeared as quickly as they came. But inside their bodies, something much more serious was unfolding. The body whispers before it screams. And for many older adults, dizziness is often the first whisper. These real stories matter because they show how easily we can mistake a warning for something ordinary. They show how critical it is to pay attention to patterns, even the small ones. And they remind us that recognizing these signs early can protect our independence, our memories, and our future. In the next part, we'll talk about the steps you can take today to protect yourself and respond wisely when dizziness appears. What seniors can do today. Now that we've explored the science and heard real stories from people just like you, I want to shift our focus to something just as important, what you can do today. Not next month, not after another doctor's appointment, but right now. This is the part where your awareness becomes action, where a small decision can change the direction of your health. The first step is learning how to recognize when dizziness is serious. Not every episode of dizziness signals danger, but sudden, unexplained dizziness deserves your attention. If it comes on quickly, without an obvious cause, that alone is a sign worth noticing. If dizziness appears with other symptoms, like blurred vision, pressure behind your eyes, numbness in the face or hands, or unexpected weakness, think of it as your body waving a yellow flag. It's not telling you to panic. It's telling you to pause, pay attention, and consider what your brain may be trying to tell you. One of the simplest and most powerful habits you can start is consistent hydration. Many seniors tell me they drink water when they remember, but the brain and heart do better when hydration is steady. Think of hydration like feeding a plant. You don't wait until the leaves droop. You water gently and consistently. Sip water throughout the day instead of drinking large amounts all at once. Keep a glass near you, refill it often, and treat it as part of your routine, not an afterthought. Another habit is rising slowly from sitting or lying down. As we age, the body takes longer to adjust blood pressure when we change positions. Standing up too quickly can cause blood flow to drop just enough to make the brain react with dizziness. Taking just a few seconds to rise slowly gives your body time to stabilize and protects you from those sudden waves of imbalance. Monitoring your blood pressure is also essential. Check it in the morning and again in the evening, not just when you happen to think about it. You're looking for patterns, not isolated readings. If you notice that your blood pressure jumps by 15 or 20 points unexpectedly, especially on days when you feel dizzy, that's a sign that your body may be struggling with unstable circulation. Pay attention to dizziness after salty meals as well. Restaurant food, canned soups, sauces, frozen dinners, and even some breads contain more sodium than most people realize. High sodium pulls water out of your cells, thickens your blood, and forces your heart to work harder. If dizziness consistently shows up after these meals, your body is showing you exactly where the problem begins. Tracking your symptoms can be incredibly helpful. Keep a small notebook or use your phone to jot down when dizziness happens, what you were doing, what you recently ate, and whether you felt stressed or dehydrated. Patterns often appear faster than you expect, and those patterns tell a story that helps you understand your body in ways that even a short doctor's appointment may not reveal. Seek help right away if dizziness appears with any red flags: numbness, vision changes, slurred speech, confusion, weakness, or severe headache. These moments are not wait-and-see situations, they're act-now situations. You deserve to feel safe and protected, not uncertain or afraid. Preventing a stroke is not about fear. It is about awareness and empowerment. Your daily habits matter. Eating heart-healthy meals, reducing sodium, moving your body every day, managing stress, and staying hydrated create a body that is more resilient, more balanced, and more capable of protecting your brain. And before we move forward, I want to pause and say something that truly matters. If this information is helping you understand your health better, please subscribe, like, and share Senior Health Daily. It truly motivates us to continue creating life-saving content for you. In the next part, we'll clarify some common misunderstandings about dizziness and stroke, so you can approach your health with confidence, not confusion or fear. Important clarifications. Before we bring everything together, it's important to clear up a few misunderstandings that I hear all the time. These clarifications can help you stay grounded, calm, and confident as you navigate your health. The goal is not to create fear, but to give you the clarity you deserve, so you can make decisions based on knowledge rather than worry. The first thing to understand is that not all dizziness is related to stroke. There are many causes of dizziness, from ear and balance issues to dehydration to changes in blood sugar. But here's the part that matters. While not every episode of dizziness is dangerous, every episode of sudden, unexplained dizziness deserves respect. It's your body's way of telling you something changed. You don't need to panic, but you do need to pay attention. When dizziness feels different, comes on quickly, or appears with other unusual symptoms, It becomes a meaningful sign rather than a harmless inconvenience. Another important point is that not everyone experiences dizziness in the same way. Some people feel a spinning sensation. Others feel lightheaded, unsteady, or as though the room suddenly shifted. Some describe it as floating, wobbling, or a moment where their vision skips. All of these sensations fall under the umbrella of dizziness, and all of them matter. Your experience is valid, even if it doesn't match someone else's story. Medications can also both help and complicate dizziness. Certain medications improve circulation or heart rhythm, while others can lower blood pressure, affect hydration, or alter how quickly your body responds to changes in posture. It's not always easy to distinguish medication side effects from early warning signs, which is why paying attention to patterns is so important. If dizziness begins after starting a new medication or changing a dosage, discussing it with your healthcare provider is essential. Another clarification is that dizziness becomes more meaningful when combined with other symptoms, even subtle ones. You may notice numbness, blurred vision, trouble finding words, balance changes, or confusion. These moments don't always last long, but their presence tells us the brain may not be receiving the oxygen or blood flow it needs. Recognizing this combination early can be the difference between prevention and emergency. It's also important to understand that knowledge is empowering. You are not meant to diagnose yourself or carry the weight of uncertainty alone. The goal is awareness, not fear. When you understand how your body speaks to you, you gain control. You learn to respond wisely, calmly, and confidently. You learn to ask the right questions and seek help when needed. And finally, remember that fear is not helpful, but awareness is. Anxiety clouds judgment, but understanding opens the door to action. You are not fragile. You are not helpless. You are capable of listening to your body, recognizing its signals, and taking steps that protect your brain and your future. As we reach the end of this journey together, I want to take a moment to honor something truly remarkable. Your body has carried you through every season of life, through joy and loss, through challenges and celebrations, through moments of strength, and moments when you weren't sure you could keep going. It has protected you, supported you, and stayed with you in ways you may not always recognize. And now, in this chapter of life, it simply asks for your awareness and care in return. Stroke is sudden and silent. It often arrives without warning, changing lives in an instant. But the beauty of knowledge is that it gives you power long before that moment ever comes. Prevention doesn't need to be complicated or overwhelming. It lives in the choices you make each day. Every glass of water you drink helps your brain stay nourished. Every low-sodium meal you choose protects your heart and blood vessels. Every blood pressure check gives you insight into what your body needs. And every quiet moment you spend listening to what your body is trying to say protects your future independence, your clarity, and your ability to live life on your terms. I want you to remember something with your whole heart. You are never alone. Senior Health Daily is here to walk beside you, to guide you with honesty, compassion, and the experience I've gained from decades of caring for people just like you. My goal is not to frighten you, but to empower you, to help you feel confident in understanding your body's signals and responding with wisdom rather than fear. Thank you for spending this time with me. Thank you for caring enough about yourself to learn, to listen, and to grow. You deserve health, clarity, and a future filled with strength and peace. If this message has touched you or helped you see your health in a new way, I invite you to subscribe and stay connected with Senior Health Daily. Together, we can continue building the knowledge and habits that protect your life and your future. Your best days are still ahead.